From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I'm your host, Jeff Reed, with my co-host, Chris Marr. We come to you on Saturday mornings, talk to you in this area with Sumter and Lee County, reaching all the way to Columbia and, of course, Clarendon. All kinds of medical issues. I want to thank our guest last week. It was a little bit different than medical issues when we talked about abuse. And want to thank Claire coming on and, of course, Cheryl Fluharty to talk about the Purple Purse Month and bring a tremendous awareness to abuse. It's not just abuse, physical, and you mentioned, Chris, it's the physical, the financial, the mental abuse.
Yeah, I think it was a great discussion we had, and a good plug for the YWCA in Sumter, who does such a tremendous job, has such a depth of resources to help individuals who are in need and in crisis with no other place to go.
And I believe it's the only place in town where a mother can leave, bring their child, and we even talked about this is for spousal abuse for husbands as well, and they'll house you, and they'll feed you, and they'll clothe you, and they'll educate you, and if you need a driver's license, they'll help you do that.
And they don't stop there. And the weeks and months afterwards to try to rebuild your life and get back on your feet. Yeah. It's all there and ready to go.
Super group. So get out and support the YWCA. We support the YMCA, which we have a tremendous YMCA as well. But boy, help them. They do so many things. And we always talk a little football. Clemson won, beat Boston College, and today I'm going to give you the forum. Carolina, So win against
are
Vanderbilt.
You telling me we're going outside of South Carolina?
We're going to do this because something happened that never happens. Your Pitt Panthers, right, are in the top 25.
Top 25.
I saw that.
It's been a couple years.
I didn't even. Are they in the ACC?
Well,
they keep moving. They are.
Yeah, they're moving around. They were Big East when I was going to Pittsburgh. So, yes, they are ACC. Record of 5-1.
So
top 25.
I don't think they're in Clemson's division. So me and you could have some fun shows coming down the line.
So it could get interesting.
It could be.
Yeah.
You, Dr. Louder, Clemson,
interesting.
Pittsburgh. Wow.
Now Pittsburgh, I'm quite certain does play Clemson for basketball.
Oh yeah, you'll play basketball.
Yeah, basketball.
But I think what will happen is you will get in your ACC championship. So if y'all can win out, Clemson wins out.
Could be really interesting. Really interesting.
Could be the thing that keeps Clemson from the Final Four. So it'll be interesting as it rolls out. Congratulations to our first game without Coach Spurrier. Beat Vanderbilt. Yeah. It wasn't the prettiest game, but it was a win. So Gamecock fans, Tiger fans, Panther fans.
The Panthers win this weekend?
Your Panthers.
Oh, and Pitt Panthers.
Yes.
Yeah, Carolina Panthers did win this weekend.
Hey, the Carolina Panthers went to Seattle and beat them. Big win.
They did.
From behind.
It was a great game.
So, enough of our sports.
We've tied it up for the week.
It is Medical Forum. We are so proud to come to you every Saturday, and then we re-air, of course, Sunday from 2 to 3. And we try to keep this on not just medical issues. We've had home health. We've had hospice. We've had physicians. We've had surgeons and such. And today, we are graced by a good friend of mine, Susan Humphries, and she is a massage therapist. And there are so many things, Chris, I know you see a lot of people that need this service. And we're also very blessed in town to have Central Carolina is a tremendous resource to train people, and they're turning out students like Susan Humphries. So, Susan, thank you for coming here on a Saturday morning.
Thank you so much.
Why don't we like to give everyone a chance to give a little background. We learned a little bit about your Alabama affiliate, that you are an Alabama Nick Saban backer. But aside from football, tell us about Susan Humphries here.
Well, massage therapy was actually a midlife crisis for me, sort of a chain of events that had happened. I was always active. Got very involved with the Y about 3 years ago and started training with some members of the Y and became a fit team member and got my personal training certification and started teaching a class or two. And I also taught, I'm personal trainer certified, I'm silver sneakers certified, and I'm also senior fitness certified. So I taught this silver sneakers classes at the YMCA and some resistance, and just fell in love with it, and happened to be at Central Carolina one day and saw the massage therapy program and thought, I might like that. And it was much, much harder than I ever dreamed, and just fell in love with it. And so,
well, let's talk about the program if we can in the first segment, because I happened to see an article in the newspaper. It might have been Tuesday in the item, and it talked about the very program that you signed up for.
Right.
Talk about that. Who heads it up? How long is this program? Is it a 2 semester? Is it a 9-week program? Tell us about the program.
It is 915-hour program. It is a lot. It's for 1 year. Is very intense. The time that between the first semester and the second semester, there are a lot of people who drop out for various reasons, because it's not an easy course. You are only allowed so many absences. It's very demanding, and there were many times I thought, my goodness, I'm a personal trainer. I know the muscles, but not to this depth. I did not know how all of the systems interact together with muscle manipulation and all of that. And you learn all of that. And Central Carolina is also, Bren Jackson has worked so hard, and he has set it up where the students can go and intern at Toomey and intern at Clarendon and McLeod, as well as a few nursing homes in town, as well as some day spas. So we're able to, and we have the clinic in the school that you can come and we can practice. And so we have lots and lots of practice by the time we get out.
So 900 hours. What is that? And that equates to about a year?
It is a year. It's a year-long program.
Does it start in the spring, start in the fall, or can you join? So it's a fall program.
And it just goes fall to fall. So, it's not, you can't come in midstream, because it is, you are building, constantly building on what you've learned before.
Gotcha.
And
she's Susan Humphries, Sumter Massage Therapy. We're going to find out about, not only did Susan graduate and go through her middle, Dr. Marr, she's got her own business. Her and a gentleman named Sean McGrew. Sean couldn't attend today, but I'm sure Susan can cover for him. And they're located right there across from the YMCA. Can't miss it, right beside Johnny's Garden on 504B Miller Road. But phone number 774-4333. Even I can remember
very
that.
Very easy. That's right.
And we're coming up on our first break. I want to thank our sponsor, Reliable Medical Equipment, right there on Broad Street, 246 Broad Street. Phone number there, 934-9212. They'll take care of you for everything, for your medical equipment needs, prosthetic, respiratory needs. Go by and see them. And we'll be back with Medical Forum right after this.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back on this Saturday morning. Thanks for joining us. Remember that we re-air on Sundays at 2 o'clock if you missed any part of the show today. This morning, I'd like to thank our sponsors, AYS, or At Your Service Home Care, for all of your in-home needs. Go see Christy or Sharon at 1250 Wilson Hall Road. Give them a call at 803-607-9677. And we are here today with Susan Humphries talking about massage therapy. And when we left the break, we were talking a little bit about your education, Susan, and the intensity of it.
Very intense, yes. By my third semester, we were talking about trauma. What is trauma? And the first words out of my mouth was first semester kinesiology.
Right.
That was trauma.
Right. Yeah, absolutely.
That was traumatic.
So kind of an intense training that you guys go through, not just the skill set necessary to perform that, but really the basis of why you're performing these specific skills in anatomy and physiology, kinesiology.
Right, and how it all fits together. Anyone that touches or puts their hands on another person can really hurt them and can cause a lot of adverse effects. And so unless you know what you're doing and why you're doing it, a lot of the modalities are the same. I mean, we're still manipulating the muscle, we're still manipulating the joints and all. But your intent kind of frames what it is that you're going to do. And there are things that you might not want to do if someone is going through treatment or just different things. And you have to know what you're doing. You know, if someone comes to you and says, I've got a bulging disc, then you need to know what is appropriate and what's not. And so we get into all of that. And, of course, the medications that people are on as well affects, you know, if they're on painkillers or blood thinners or things like that. You know, we've studied that we have pharmacology class as well. So pathology class. So it's very intense.
Yeah, you mentioned about 900 hours.
Yeah.
Most classes are around 500 hours.
Correct.
So you're doing twice as much.
Correct.
And I assume then that gives you, again, we're throwing around pretty big words. Just for anyone listening out there, anatomy kind of speaks for itself. We're talking about, you know, parts in the body, but you know, the circulatory system and such like that. Kinesiology, I've always associated that more with a sports term. It's the body moving.
It's the body moving, correct.
Okay.
Correct.
So what's interesting, I did a little research before the show, massage therapy is growing at 23% a year since 2012, and it looks to continue on that path until the year 2022. Much faster, it says, than every average of all ages.
Right.
So it sounds like you're getting right in the midst of a really good market here.
Well, the benefits are across the board. I mean, they're undeniable how the positive effects of whether it's just being touched or whether it you know, for palliative and nurturing, or whether it's you know, please help me move my shoulder, I've got this huge knot, for just wellness. And it is growing because people and doctors are becoming, it's not a luxury so much as it is just part of someone's wellness lifestyle.
Dr. Marty, you prescribe massage?
Absolutely, and recommend it fairly regularly. There's variabilities as to whether it's covered for insurance, and that's oftentimes a hurdle or a roadblock as to getting the treatment. But the patients who receive, massage therapy are all happy with their treatment.
Right.
There are certain treatments that we prescribe in medicine that may be helping you, i.e. taking a cholesterol medicine, but you don't feel the effects of it. But when a patient goes and has massage therapy, they feel the effects of it, and generally speaking are very appreciative and have a significant benefit.
Right. And even as someone who works with patients that are referred to me, I'm the one person who's not going to come and poke you with a needle. I don't want anything from you. You don't need to tell me, things about what you did, how did you get in this condition or whatever. I'm just there to do whatever I can to make you feel better and to work with you.
Well, let's talk about that, because when we associate not feeling good, pain, and of course we have a tremendous physician, specifically a pain doctor, and Dr. Warwick.
Right.
And some of your training, you had mentioned that you were able to do Central Carolina, work with the hospital and such. So you've worked with Dr. Warwick.
I was very fortunate. I am one of the very few that was able to actually intern with a doctor. No one that in Central Carolina's history has been able to do that. And I was the first that was able. Dr. Warwick agreed to let me come in and work, and he would prescribe. I want you to see these patients and work on, and he would tell me what he wanted me to do, whether it was upper back or neck or lower back. And I would meet with the patients and talk with them about their goals and what was going on. And we would all kind of collaborate what to do. And I was very fortunate. He was extremely, extremely supportive and helpful if I had any questions. Yes. And Brent Jackson, my instructor, was there with me the entire time. So I had supervision to be able to do this.
Now, would you come in, would you go to the home, like a referral, or would you?
They came to Dr. Warwick's office to see me. And I was there for a few hours on Tuesday afternoons, and Dr. Warwick would have a certain people that he'd say, you know what, I want you to come in on Tuesday if you can. A massage therapist will be here, and she, I'd like you to see her and tell me what your results were. And my understanding from Dr. Warwick is that they exclaimed great results and some of the pain treatment and just feeling better for a few days after the massage. So,
well, we talked about pain, but when I list of the potential benefits, and we might just grab a couple of these because there's 30, 40 of them, that are out there.
Right.
Shortened hospital stay.
Right.
So I'm in the hospital for possibly some kind of back surgery, or maybe give me an example of that.
Well, when we were interning at the hospital, at Toomey Hospital, we were going into, on all the different floors, we could go in and just, people respond so much better if I didn't want anything from them. I'm just simply coming in here and, can I just give you an arm massage, and they were so, it releases, all kinds of emotions in them, and they feel better and have such a positive outcome after all of that. But they also seem to have a better outlook on the hospital itself. Just to be able to see people coming in and someone's there to make them feel better, to just know. And of course, massage is also thought of as the luxury. Such hospital is allowing these people to come in and that luxury.
She's Susan Humphries. Susan, we'll come back and talk about some of these other potential benefits to massage. But Susan Humphries, Sumter Massage Therapy, and we will be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we're back, Medical Forum. I'm your host, Jeff Reed. Our guest today, Sumter Massage Therapy owner, Susan Humphries. You can find her on Miller Road. Give her a call. Phone number 774-4333. We've learned a lot about Susan and Central Carolina and the tremendous training they do there. And also want to give a shout out to Toomey Hospital. First of all, congratulations on the settlement. Dr. Marr, we'd be remiss if we didn't bring that up with all the tremendous help they've given us through the years. And we hope that this is the start of a new beginning and everything. Gets the I's dotted and the T's crossed. Also, support their golf tournament November 6th. And of course, it was rescheduled after the rain that came in October. And we got our hospice trees coming around. So Kim Price, support them as well. So Timmy with a lot of great nonprofit organization coming up the pike here with the golf and the trees. So give Jeff Fall or anyone at the foundation, call 774-9014. And Susan, when we left the break, we were talking about all the potential benefits to massage. And pain, of course, is one that we see so much, and we're used to that. But we look at, and now I'm thinking, when you mentioned about hospital stay, maybe getting people out of the hospital quicker. But I'm thinking, and I'm going to be sarcastic a little bit, I think I might want to stay in the hospital longer. If Susan's coming around and we get massages, do you think this could be counterproductive at all, Dr. Marr?
Potentially could be.
Yeah.
I hope the government doesn't find out about it.
And you can do that, then fine. No.
You can still come and see me on Miller Road.
Okay, very good. But one of the things that we talked about during break, anxiety and relaxation, and so many people are stressed.
They are.
Raising kids, raising a family, one family, parents, all the things that are going on this trying time. And yes, there are medications that help alleviate this, but massage is one.
Right. I think for a number of reasons. Obviously, just the relaxation part of it, but the touch part of it. Someone is paying attention to you, and all I'm asking is that you just relax and just let it go for a little bit. I had a girl come in the other day, Monday. A friend of mine called me and said, one of my coworkers, her back is just hurting her. It hurts so bad to move. She thinks it's all stress related. Can you work her in? And she did come, and it was extremely tight. She was so stressed out that by the time she left, she said she felt like a different person. She had more energy, and it wasn't that I did anything, magical. I think it was a number of things. She was able to relax. She was able to just let it go for a little bit. That our rooms are.
Well, let's start with that, because I want to ask you about. Let's see if we can take our listening audience into your room.
Oh my goodness!
All right. Now we know where the location is. We're right across from the Y.
Right.
And by the way, the road is clear.
Yes, it is.
So you can come either side.
Yes, it is.
And I'd like for you to take us through the process, because I think, number one, it's very private.
It is very private.
So for anyone that's, am I, or will there be people out there?
Right.
Take us through that. And then, Dr. Marr, if you can bring us through some of the different massages that, that we have on here, and we're going to ask you about them to differentiate. So take us through. We've come into the door.
All right.
What happens?
Well, once you walk in, we will ask you, either myself or my partner, Sean, will ask you to fill out a questionnaire, which is just about your history. Are you on any medications? Is there anything that you've had any surgeries? Have you had a hip replacement, which is very important because we both stretch during our massages. So there are things that we need to know about you. Because I work mainly with not athletic. It's more either patients or people that want to come in just for relaxation or just to take a deep breath. My treatment room is set up where I'm not going to talk with you out in the lobby. We're going to sit down in my room and chat about where you are, what your goals are, what can I do for you, and we'll go through the questionnaire, and then I will kind of tell you what I am going to do so that you have an idea of what to expect, and then we turn some music on.
And what type of music? Just nice,
nice and soft, and very relaxing. Unless I have someone who wants to talk, and I can turn the music down, and I'm all ears. So just depending on why they're there and what I'm feeding off of what you want for the mood and what I can do for you.
So do patients typically come in with specific goals and expectations that you're trying to fulfill? If someone comes in with a prescription, are you using those as goals? Or if a patient comes in and just says, I don't really know what I want, but my neck hurts. Right. How do you differentiate or go through each of those cases?
Then we go through all the different services that we offer and put down. Are you looking for something that is full body, where it's very arms, fingers, legs, just the whole thing? Or are you looking for something very specific? Just my neck. I don't have a lot of time. I'm on my lunch hour. If you'll just work on my neck for 20 minutes, that would just be great. And we do have something called 20 for $20. It's 20 minutes for $20, where you can come in and I will work, or Sean will work just on your neck or just on your hamstrings if that's what's bothering you. And we will talk it out is what we do. Just to make sure that you are satisfied with what I'm going to do and that I have met your goals, because it is all about you. I mean, you're there to see me so I can help you. And we'll kind of knock some things out, and it might not be relaxation. It might be, I want you to vigorously stretch me, and we can do that. So we it's communication and then deciding on the intent of the session.
So are there certain scenarios where maybe, I use the euphemism with patients all the time, Rome wasn't built in a day, and that sometimes, there's homework to do, and successive sessions that are required.
Right. Oh, certainly. And if someone has not been worked on or had a massage in a long time, their tissue can be very tight and hard to get through all the layers, by the time you finally get there, it's time for them to go, depending on their schedule. But it takes a long time sometimes. But then other times, I have a gentleman that was referred to me by Dr. Warwick, and he came in, and it just terrible neck pain. and it took me an hour to work on his upper back and neck the last time. This time it only took 30 minutes because his tissue was already
Gotcha. Yeah.
ready to go.
Ready to go. She's Susan Humphries, and we come up here on a short break here. And when we come back, we're going to talk about Sumter Massage Therapy and all the services that they have. And for anyone who's driven by, they marketing their information right outside the door. So for any of you that came down and maybe had to turn back around because the road was there and saw them and grabbed a card, we will go through each one of these and describe what each one means. All right? We'll be back right after this.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And welcome back to Medical Forum on this Saturday morning. And just a reminder that we re-air on Sundays at 2 o'clock. So if you missed any part of this broadcast, it will re-air again at 2 o'clock, as well as all of our old shows are archived on our webpage, At Your Service Home Care. Visit the webpage and click on the radio show, Medical Forum. And all of the shows from the very first one, from the very beginning, are archived there. So you can pull up any show and take a listen to it. If there's any particular subject you're interested in. I'd like to thank our sponsor, At Your Service Home Care. Again, the website to get on that Medical Forum webpage is www.ays-homecare.com. We'd also like to thank our sponsor, Medical Services of America, represented very well in the Sumter community with Medi Home Care, durable medical equipment, Tri-County Home Health, and Tri-County Hospice Services. So
got a great doctor there at hospice.
That's what I've heard. Yeah. So any questions or concerns? The home care and the hospice is located over on Tahoe Drive, 2560, and you can call them at 356-1600.
Do a good job.
Do a good job.
Do a great job.
So we're back. We're talking with Susan Humphries today from Sumter Massage Therapy. And one of the things I'd really like to get into and talk about is, and this is something really that I need to be educated on, is the different types of massages, kind of the goals for each of these types of massage. Swedish massage.
Sounds
it sounds ethnic.
Relaxed.
It sounds ethnic. Sounds like there should be
a
certain food associated with it.
Right.
But what are the difference really in what you have listed
wine and
here?
grapes,
Wine and grapes, and maybe meatballs. Maybe meatballs.
Here, I'm imagining like Caesar coming down here with his grapes being fed.
Yeah, that's right.
Not that he was Swedish. Not to my knowledge.
No, I don't think so.
No, I don't either.
He was Italian, I'm quite certain.
I think so. You talking about the guy who owns the pizza box?
Yeah, Little Caesars.
Little
Okay.
Caesar.
Yeah.
Now back on subject.
Yeah,
Back to where we were.
We're going to edit all this out anyway, so no one will hear it.
So let's talk about some of these different massage modalities that are listed here, and I'm sure there's probably more than this. These are kind of the general headings,
right.
And there's probably some specifics in with each of them, but let's start with Swedish massage. It's the top on the list. Tell us about that a little bit.
That is what most people think of when they think about massages. It's relaxation. It's simple, just muscular manipulation. That's, it's not very deep. It's very relaxing. That is what, usually if someone gives you or talks about, oh, I just had a massage, I'm so, they're usually talking about a relaxation massage. Now, every massage therapist does their Swedish a little different. So just because one person, like I do stretches in mine, because with my personal training background, I feel like if you're manipulating the muscle, there should be some stretching involved as well. But it's not hard and it's not invasive. It's still very relaxing. Very relaxing. So that is a Swedish massage.
So what would the goals of a Swedish massage be?
I come in, I just need the world to go away for 1 hour. I just need it to go away. This
sounds to me like a resort.
It is
a resort massage.
That's right, and that's basically what it is. Correct.
Okay.
Very relaxing. The music and just the whole.
Now I see in increments of 30, 60, and 90.
Correct.
What do you see normally? Is an hour what people 30 minutes?
For Swedish, yes. Usually it's 30 minutes is awfully short for a Swedish massage because it does involve the arms and the legs and the feet and the hands and of course your back and all the other muscles. So that 30 minutes is, boy, you're booking it to make it all the way around the table, turn it over and go back around.
90 minutes seems like a long time to me. I mean, is that? It would be
it would be a very long time, yeah. But unless you're going to incorporate, and you can incorporate. I want a Swedish massage, but I also want a lot of focus on my lower back. Spend an extra 20 minutes on my lower back. And so the 90 minutes is basically what that helps with. I want the whole relaxation experience, but I want extra work done on my neck or my back. And you can even choose. I want 10 minutes extra on my back, 10 minutes to make it up.
Right.
So it's all very goal-oriented.
And you're priced very competitively because if anybody looks out or has had massage, $30 for 30 minutes, $60 for 60 minutes, and 90. It's very simple math to come across.
Right, and you get 20% off your first visit on any massage over 30 minutes. So any of your 60-minute massages, any of your 90-minute, you get an extra 20% off for your first visit.
Throw in one other little advertisement that I saw. If you're a YMCA member, is there a little something in it for your team at the Y there?
My partner Sean and I are very involved at the YMCA. Both of us have trained for competitions there, and we work very closely with John Hoffman, who's a wonderful CEO, and Missy Corrigan as well. Work very closely with them. But if you are a YMCA member, you get a 10% discount right off the bat. So anytime that you come in after the first one you get the 20% off. Anytime after that. But Sumter Massage Therapy sends in an extra to the YMCA, an extra 5%. We give that comes out of our pocket back to the YMCA to help support the children who maybe their parents don't have anywhere else for them to go after school or whatever, any of the programs, we donate. So we give 5% of our earnings back to the YMCA.
Very good.
Yeah.
So it's 10% off just for being a YMCA member.
Right.
And then additionally, you, out of the remainder of what's been paid, give 5% back to help the children and such at the Y.
Yay.
Well,
yes.
that makes it right there
Yes.
worth it, Chris.
Yeah, the pricing's tremendous.
Yeah. Swedish massage. So we got that. Therapeutic massage. What differentiates?
Well, this is more of a, it depends on why you're there. If you are there for pain management, or if you are there for stretching, my neck hurts, I need you to really dig and get as deep into the tissue as you can and try to work out some trigger points and some, or knots as we call them. It can be for stretching, and it can be, it's very specific to what you are trying to, what your goal is, whether it's flexibility or trigger points and things like that. It's neuromuscular therapy and sports therapy, things like that, all go under the therapy.
Very good.
Now, for a therapeutic massage.
Well, let me. Because I want to hear what your question is on that, Chris. We're coming up on a quick break here. I want to thank Bynum Insurance, always, Karen, and the whole bunch down there in Ed, 469-3030. And when we come back, Chris, I want you to follow up with that question because I think it's going to be something that you really want to touch on here. And we'll come back with our final segment with Susan Humphries.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we are back visiting with Susan Humphries. And when we left our last break, Dr. Morrow, you're in the middle of a great question. I really wanted you to ask that and have full time for you to answer this, Susan. So, Dr. Morrow, we were talking about the Swedish massage, therapeutic massage, the fitness, the sports.
Yeah, I was just going to ask about kind of Susan's recommendations about different types of massages. So kind of time recommendations. You know, if someone really wants to come in and have the Swedish massage, like you said, that 30 minutes might not really be scratching the surface.
Right.
Versus a therapeutic massage versus a fitness massage that has a very specific goal in mind.
Right. I think that a Swedish massage, 60 minutes is perfect. It gives the therapist enough time to go to address all the muscles without overworking an area, and it allows enough time that the client or the patient can fully relax. Because I am not one that relaxes very easily, and you would be hard pressed to get me to relax, so that you would be able to, so that I would be able to get the full benefit of relaxation. But in 60 minutes, we can do that. If I can do that, I'm not pushing you around. It's just very
well. Let's talk through that, because some people are used to going through an airport, and they see these, just right there in front of everyone, and people come in there, they have their shirt, they stick their head down into this round circular donut looking object, and then they just work on them there. This is a table. You do start off on your stomach, I assume.
I do.
Yes.
Again, everybody's different. I like to start on the table with people face down.
Right.
So for two reasons. One, I have a table warmer, so that the front of their body is getting warm, and makes it easier for me to work on them when I turn them over, because they're already warmed up. And the second reason is all the little wrinkles from the headrest has time to go away before you leave my building, so that you don't look like you've just...
good point. Absolutely. I see that.
Always trying to think of... that's right.
All right, so now you've come in and you've chosen your massage, and what... For anyone who grabbed the card, we certainly recommend 690 could be applicable as Ask at 30. I see you have 2 for 20. Talk to us about that.
It's 20 for 20.
Excuse me.
Yeah.
Yeah.
Well, that's something I insisted that my partner and I do, because I don't have time a lot of times for an hour-long massage. I just want to be able to just...
You personally, not you as a...
Oh, no. Personally.
You mean if you had, if you were...
think from a client-patient perspective. If to be able to come into our place and say, I want 10 minutes spent on my neck and 10 minutes spent on my lower back, or 10 minutes on my hamstrings and 10 minutes on my lower leg. So it's 20 minutes for $20, hands-on, the specific areas that you want me to work. Nothing else. And I will use hot towels or stones or whatever it is that I need to use to be able to do what it is I need to do.
This sounds like I'd rather do that than lunch.
Right, and you would
does
have time.
Sound like a great alternative.
Right,
You know?
it's a lunch.
If I have a 30-minute break, it takes me 5 minutes to get there, say.
Right.
20 minutes, got Susan's ready, got us bam, bam. We work on the back, we work on the leg, we work on the shoulder, whatever. Back to work.
Right.
Let's talk about some of the modalities that you just referred to and how those are used in your massage therapy.
Everyone is different. I use hot towels. I will also use the warming gel if necessary. Helps me to warm up the tissue to be able to, and it feels good to be able to get in there. It lessens the time that I have to manipulate the tissue for me to be able to get in to do what it is I want to do. I like to use the hot stones.
All right, let's talk about that. Wait, the last thing on the sheet, hot stone massage, which a lot of people are going, what?
Right.
So let's talk about that. And that's 75 minutes, no 30, no 60, no 90. Right. There must be a method to that. Well, 75 minutes.
It is a Swedish massage that we also use hot stones in it through the whole thing, on your arms, your legs, your hands, your back. So it is.
And these are stones.
These are stones.
And they're hot.
They're very hot. They are very hot, but they feel amazing. It's just really, it's nice to have a hot stone.
So on the Swedish massage where you're using your hands, we're using now the hot stones.
Right, and the hot stone might be in the palm of your hand, or it might be a tool that you would use it, say, as a tool to cut through some of the muscle and warm it up. And so it can be done. You can use the stones in a variety of ways.
What do you think about that?
Yeah.
Chris? Could you do that?
I think 20 to 30 minutes.
See, I'm going to tell you what. I will tell you what. I'm on record right now. I will buy you, Dr. Marr, the hot stone massage.
75 minutes?
Yes.
I'm just going to make one request. I think you're going to need a roll of duct tape to keep me on the table. 75. 75
See,
minutes.
I think it would
he
be
doesn't
up
sit
before you knew
still.
it.
He doesn't sit still. That's the problem. All right, we've got about 2.5 minutes left.
Okay.
And what I want to get across, when are we open? Is it by appointment only?
We are open Monday through Saturday. It is basically by appointment only because I do volunteer to go do some other things, and so does my partner. But you can go online. It's Sumter Massage Therapy fullslate.com.
Okay.
And you can schedule your own appointment. And so we are there. We are certainly there when we know an appointment is going to be there. But otherwise, we might be. And of course, when we are in session, we do lock the front door. So if there's no one up front to kind of monitor what's going on.
So can you book online?
You can book online.
So you can book your appointment right online.
Yes, you can. Yes.
Fantastic.
I know.
Talk real quick. You mentioned about the hospital. You're doing a lot of donation of your time up there, especially on the oncology unit.
I am hoping to begin that very soon. Yes,
Great.
I've talked with the volunteer services. Of course, I was there during internship.
Sure.
So I was on the oncology floor, but that is a passion of mine to be able to
just to offer your services.
Right,
I think
exactly.
speaks volumes.
Exactly. Something I'm looking forward to beginning very soon. So.
Well, she is Susan Humphries.
Well, I think one of the cool things is people are going elsewhere. I mean, thinking about can't wait to get to the spa when they get to Asheville or wherever they're going. These services are right here in Sumter.
Right.
So how great is it to introduce this right into
I would say
your
right
daily
up there
routine?
with golf clubs, golf balls. So if ladies are listening out there, I think the men would enjoy this.
That's right.
Don't you think?
And men
Absolutely.
who, hunting season is here. You're leaving your wife a lot.
Right.
Gift certificates for a nice massage is a good thing.
There you go.
Help
And
you
don't
along
ask.
the way.
I have found,
don't ask.
and my wife, and she'll attest this. Don't ask if you want a massage. Schedule her a massage and tell her what time.
Boom.
It is.
That's right.
She will.
That is
she
amazing.
will work her schedule
And make
around
sure
it.
you schedule
She
it
will work
at
her schedule
Sumter
around it.
Massage Therapy.
That's right.
Online, sumtermassagetherapy.fullslate.com. And Susan, thank you so much.
You're so
Tell
welcome.
Sean we said hey.
I will do it.
And we will see y'all next week.
I hope
Thank
so.
you.
Yes.